Well, good afternoon. This is Dr. A with Pro Health Services, and I'm so excited to be back here with another Facebook Live. It's been a while since I've done one, and excited to be able to share information. So, as I said, my name is Dr. A. I'm a medical doctor, and I specialize in enhancing your health and wellness to improve your quality of life, to help you look and feel your best on the inside and out. And that truly is my passion because I want people to look and feel their best. And if you look at me today, you might say, okay, well, what do I know about obesity? Well, I can tell you that I have given birth to four children, and with each pregnancy, I've gained weight. And with the first two, my weight bounced back pretty quickly, but with my last two, it didn't want to bounce back. And I typically gain 50 pounds per pregnancy, which is more than I wanted to, but that was my real life. And so I have had that journey of trying to lose that post pregnancy weight, and I'm glad to say that I've been successful. But I know there's other people out there who also might be struggling to lose weight or to have a healthier weight. So again, why is this important? Well, you realize that over 2/3 of all Americans, adult Americans, either have obesity or overweight. And so if you look to the left and you look to the right and you look at the person in the mirror right in front of you, two of those three faces are struggling with either obesity or pre-obesity, and a lot of people didn't get helped by the COVID-19 pandemic. A lot of people gained their COVID-19 pounds, but this is a very common condition. And the reason why it's so important is because there are so many health consequences as a result of obesity and pre-obesity. Obesity and pre-obesity can increase the risk of things like heart disease, high blood pressure, type 2 diabetes, high cholesterol, heart attack, stroke, premature death, colon cancer, ovarian cancer, prostate cancer, nerve damage, breast cancer, so many different conditions that so many people suffer from, that obesity often contributes to those. And so by treating the obesity and the pre-obesity, we can reduce some of those complications to help people live healthier lives. So obesity is a chronic condition. If someone is suffering from that, it's not something that's going away overnight. It's something that's going to have to be chronically treated in one way or another. But I also have the philosophy that an ounce of prevention is worth a pound of cure. So if there's things that we can do now to keep ourselves healthier, we can decrease the likelihood of obesity down the road or reduce the consequences of obesity so that we feel healthier. In addition, if we treat obesity and we decrease the risk of heart attacks, we decrease the risk of strokes, we decrease the risk of some of these cancers, that might save some money because we don't have those expenses associated with those medical conditions. Um, for instance, I've helped several patients who've successfully lost weight, they've gotten off their diabetes medications, they've gotten off of their high blood pressure medications. I've had patients who've gotten off of their pain pills because they lost weight and their joints felt better, so they were able to walk easier. One patient recently told me that she was able to go chasing after her grandchild within 2 months of being in treatment, and she was so excited to have that improved quality of life to be able to have that mobility. I had another patient who recently lost 11 pounds in just 3 weeks, and she told me that wow, she no longer needed the extender on the seatbelt. She was able to use the regular seatbelt, and so she felt so much better about herself, um, blood pressure going down, etc. So really improving your quality of life by being able to have a healthier weight. So sometimes people ask, what is obesity? You look at someone and say, okay, do they have obesity? Do they not have obesity? We see things in the movies. But for a lot of people, obesity is really 30 pounds above their ideal body weight. But the technical definition of obesity has to do with BMI, which is your body mass index. And the body mass index is the international standard for weight, where we compare your height and we compare your weight and we divide those, and that's how we determine what your BMI is. So you take your weight in kilograms, not pounds, divide it by your height in meters squared, and that's where you come up with your BMI. So a BMI greater than or equal to 30 is the definition of obesity. And again, for a lot of people, that's simply 30 pounds above their ideal body weight. A BMI greater than or equal to 40 is known as class 3 obesity, and typically these patients are at least 100 pounds above their ideal body weight. And then a BMI between 25 and 30 is known as pre-obesity or overweight. And again, over 2/3 of all American adults either have pre-obesity or obesity. Now, as I described in the example, if someone was 5'10", and I'll go here to 5'10", and they weighed 200 pounds, that would put the BMI here at 28.69, which falls in the category of pre-obesity. So a 5'10" male weighing 200 pounds with a BMI of 28.69 is pre-obese. So how many guys out there are 5'9" and they've hit that 200-pound mark? And if so, that's already in the pre-obese category. Um, and then if we have a female who's 5'5" and weighs, say, 170 pounds, that also puts the BMI at 28.28, which falls in the category of pre-obesity. So as a woman, if you're 5'5" and you've hit at least 170, you also are in the pre-obese category. Excuse me. And again, the reason why this is so important is because of all these other potential complications as a result of the weight. So the good news, though, is that there are so many ways to treat obesity. Again, I am a board-certified obesity physician. I specialize in medical weight loss, and I've been doing so since 2009. And my heart is to help patients get to a healthier weight so they feel better, they reduce the risk of complications of obesity. Um, there's medications that can be used, there's behavior modification, there's physical activity, nutritional education. All of these things are important for successful weight loss. Our goal is to help patients lose weight safely and to be able to keep it off. So if you happen to be one of those 2/3 of all Americans struggling with obesity or overweight, or if you know someone who is and you want to improve your health by having a healthier weight, we would love to partner with you on this journey. So please give us a call at 614-442-2600, or you can visit our website at www.prohealthservices.org. And we would love to partner with you. We would love to walk with you on your journey to success. And so we hope to hear from you soon. Again, this is Dr. A with Pro Health Services, and I'll be back next Thursday at 12:30 p.m. Eastern Time for another Facebook Live. Thanks, and have a wonderful day. Bye for now.